Hey class, wanted to go over ortho patient assessment, which is taking place in the third week of ortho on Thursday, April 10th in the morning, going through until the afternoon. You will be seeing patients in a family practice setting. I've gotten standardized patients for you, so you don't need to worry about memorizing any script and being a patient for your partner. And then you are going to have 30 minutes to do a focused history and physical on an ortho complaint. Before you walk in the room, there's going to be a face sheet on the door. That's going to have the patient's name, date of birth, chief complaint. It's going to have their past medical history, social history, family history. All that stuff's going to be given to you, even the vital signs. That's going to be on the face sheet. So you take that face sheet in with you. You're going to see your patient. Faculty will be in the room. It will be recorded like normal. So you'll do your focused H&P. Now remember, all those special skills that you're learning in the first week and hopefully taking advantage of practice time throughout the ortho course, there is no skills testing per se. You're going to be signed off on the skills, practice and sign them off that you can do them correctly, but it's your responsibility to learn how to keep doing the test properly, but not only know the name of the test, but know what the indication is and what a positive or a negative means. So for example, you have a patient, I'm going to use an ankle example because there are no special tests for ankle that you're learning. So, but let's say, for example, it's an ankle complaint. Well, you're going to need to do some special tests on the ankle and then know what a positive or a negative means. After you're done with your patient assessment, you are going to, or before you're done technically, you'll give your patient a very brief education on what you think is going on. And then, like I said, it's a family practice setting, so you're going to have to order whatever you think needs to be ordered. Now, when you leave the room, make sure you take your note paper with you. That is what you are going to use to do your assignment, which is to record an oral presentation based on the case that you saw during patient assessment. I went ahead and made that assignment due on the following Monday before your next course starts by 8 a.m. Okay, so that gives you the weekend to work on your presentation. That way you can just concentrate on studying for your written exam. I did at the bottom make some Quizlets on the special tests, what the indications are and a positive finding. So make sure you're really familiar with those because you're going to need those for your patient assessment. So if you have, one more thing before I forget. So the face sheet that you'll have access to before you go in and see your patient, that will magically appear on Moodle after patient assessment is completed, and that'll actually be found in the ortho patient oral presentation section. So don't worry about memorizing or you forgot to write down things on that face sheet. I'm going to go ahead and give that to you. So that'll appear on the Moodle page, and you'll use that when you are recording your oral presentation. So with that, if you have any questions, feel free to reach out, and I will see you soon.